Hello and welcome once again to Moorgate Andrology. Today we're going to talk penis enlargement surgery facts. I want to share with you some facts about penis enlargement surgery. So if you're doing your research about this procedure, hopefully I can add to that with some interesting facts and figures. Now, the first thing I want to clarify, the first fact, is that I want to say that penis enlargement surgery is actually possible. Lots of guys call us here at Moorgate Andrology, and they can't believe that it can actually be done. Well, actually, penis enlargement surgery has been around for many years. But in the last 10 years, there have been significant developments that have improved procedures, both in the length and in the girth. So the procedure has got much better, more predictable results. Now, in terms of the lengthening procedure, this is a procedure called ligamentosis surgery, which involves the division of the suspensory ligament. The first fact to know here is that this increases the flaccid length of the penis, not the erect length. So guys who have ligamentosis surgery are concerned about how their penis looks when it's not erect. So for example, they may be embarrassed changing at the gym, going to the beach, that sort of thing. So they're wanting a bigger penis when it's on show, and they will have ligamentosis surgery. Now, the second fact to know is that the results of this maneuver are pretty predictable, because we know that in around 95% of cases, guys have an extra 1 to 2 inches more in the flaccid length. 5% will either get a little bit less than 1 inch or a little bit more than 2 inches, but for nearly all, it's somewhere between 1 and 2 inches. Another interesting fact to know is that in almost all cases, the urologist will place something called a silicone buffer, and this is anchored to the pubic bone. This is important because we need something between the two cut ends of the suspensory ligament to avoid them reattaching. Reattachment of the suspensory ligament means the penis will shorten once again. We want to prevent that as much as possible. Because of this maneuver, an interesting fact is that it's permanent. Once the buffer is in place, then the two ligaments cannot join up again, and it's considered a permanent result. In terms of the girth, this is almost always done with a fat transfer, and it can be done at the same time as the ligamentosis surgery, and most guys will tend to go with both procedures at the same time. A fat transfer is where we take fat from the lower belly and or the inner thighs, because this is where the best quality fat is. And after going through a purification process to remove blood, oil, dead cells from the fat first, it's then injected into the penis to thicken it. And in most cases, this will thicken the penis by around 1 inch. An interesting fact to know is that 30 to 50% of the transplanted fat will absorb in the first 8 weeks. This is a natural process that you can't prevent. But even allowing for this absorption, you have the kind of girth gains that I've mentioned of around 1 inch. We do see some guys who, for some unknown reason, do not seem to absorb hardly any fat at all. And in those cases, the girth gains are more, maybe up to 2 inches in those cases. After this absorption, the remaining fat then becomes living tissue with its own blood supply, and is also considered a permanent procedure, although you can in later life, if you wish, have a further fat transfer if you want to top up the girth. So there you go. I hope that's given you some interesting facts about penis enlargement surgery. If you'd like to know more, please do get in touch with us here at Moorgate Andrology. If you like this video, please do click the like button. And if you'd like to see more videos from us, please subscribe. That's all from me today. I look forward to seeing you back here at Moorgate very soon. But until then, bye for now.